So my name's Khadija. I use they, them pronouns. I'm a worker member and the founding director of the Healthcare Reparations Cooperative. We do a bunch of stuff around transforming healthcare in Minnesota. One of the things that we do is we have the Reparations Project in Hennepin County. And when we were here last time, we left you all with a project's kind of being funded, oh crap. And that's kind of a cliffhanger to leave you all with. So I'm giving you an update, and then also we will be holding an assembly here next Wednesday as well, so also inviting folks to that. Just for folks who don't know about us, we're a member-owned organization, so we are a co-op, we're a multi-stakeholder co-op, and we build new systems for health and healing in Minnesota, and really center on folks who've been most impacted by healthcare harms is our thing. And then this particular project, it's asking Hennepin County communities what reparations mean in the context of health and building that answer. We're in the first year of 4, and the 4 years are really thinking through what are we actually talking about when we say reparations in the context of health, and doing that from a people-centered approach, but that's also a power-building approach of the folks who are helping us define are gonna be the folks who are also benefiting from what comes next, and also the folks saying no, we gotta make this happen. So that's kind of the idea behind the project. That is our work and vision statement. I'm actually not gonna get into this stuff. I'm moving fast just because of time. So these are the driving questions for the project, just so folks know. So what do reparations mean in the context of health in Hennepin County? One thing I'll say about this project and that its uniqueness is this brackets here, this in Hennepin County, we've designed the project in a process that any county, any city, any state could actually insert their locale and take our process that we've created and adjust it for their own space. So this is meant to be something that folks can tailor to their own people, which is pretty unique. And then what can the implementation of place-based reparations and health, how can that transform disparate community health outcomes? I'm not gonna get into that. So for context, in this first year, we've done 8 assemblies, really looking at these different domains so that this definition of reparations does not get flattened. So we looked at things about land healing, economic justice, Black joy, queer liberation, disability justice, storytelling, and then the one that we're going to be doing next week is about lineage healing and a future of repair. So really thinking who's come before us and how does that situate into reparations in the context of health and who's coming after us. And so the other thing I'll say too is within these spaces, these are not just a time for folks to come together, but it's folks actually starting to build these definitions in this time. One of the things that we hear often from folks is cool, we're all getting together and that's great, but no, actually this is a part of defining, is happening in these, the work is right now. It's not next year, it's not the year after, we've started the work. So I would say get on it, is my 2 cents on that one. The other thing too with these is we use arts-based methods in all of these where art is an actual sense-making point, and so we've done an art practice in all of these that is a part of the information. So as an example for the land healing and repair, we actually did a clay-based art practice, and that clay, what folks created in that space is essentially a data point in how we're defining things. So we have an arts-based methodology in this as well. The other thing that's a big part of this first year is that we are doing a people's archiving process, and that is a case study that we're doing. For this first case study, we are looking at eugenics in Hennepin County specifically. For folks who are unaware, the Dite Institute existed here in the 20s, 10s, and 30s. And that was the epicenter of the eugenics movement in the United States, was here in Hennepin County. And we have actually successfully created a documented link from institutions here in Hennepin County and here in Minnesota that were direct supporters of the sterilization bills that happened here in Minnesota to being able to trace back lineage from that. And so we will be doing some direct demands and asks from this case study that are coming out of this project. So when we think about tangible outcomes from this first year, we have some really strong tangible outcomes that are already coming from this. Do you have a question?
Yeah, for the one that's the coming up, it'll be the lineage one, so that will have like an art activity to explore your own bloodline.
Not necessarily your
Or-
own bloodline, Anna, we are going into an archiving
Lineage.
space, but you will explore your own lineage, how that means to you in art-based practice. Yes. One thing about this is in terms of the community archiving, but no experience in doing archiving practices get trained up to be able to do this. So these are folks like whoever's in this room, if you're like, I wanna be a part of this, I've never touched an archive or like done any of that, it's kind of cool to get to learn how to do that.
Can you drop the assembly that's happening in the chat?
Yes, I can, yep.
Yeah.
So that's a little bit about the project. We had this op-ed that came out. But to update for folks in terms of where the project's at, just on top of the assembly coming up, we still don't have confirmation from Hennepin County that the project is going to be continuing past August. So just renaming that is still the case. We have yet to hear that Hennepin County is going to continue the project, which is a pretty big bummer that we are now here. They have offered a no cost extension of the contract for which means that they've said yes, you can continue the work through the end of the year, but we're not gonna fund it. We're not gonna put any money behind it.
Is it open to public comment?
Yeah, you can call your commissioner, you can do whatever. You can
I
show.
think you said this last time too, like call everybody.
One second, what'd you say?
Oh, I was saying, I think you said this last time too, like, yeah, call them and tell them about it.
Yeah, like I'm not gonna tell you how to behave, just know that that's the truth. And you have phone numbers at your, well, you can pull up on some people. What do you say?
Have y'all met with Connolly?
Oh, yeah. Yes.
What's her stance?
A big delay was the funding around HCMC and that being uncertain, and now that's been cleared up and we still are waiting to hear confirmation on if this will continue. So, yeah, so
We're having a meeting with her, cause she's, for our space down the street with the, at Postmodern, donation base,
yeah.
she requested a meeting with us next week.
Awesome.
So I'm gonna have to have you there or be in.
Yeah, I'm up in her business.
Okay.
Yeah. Yeah, we just like we're kind of being strung along of like, yeah, sure, possibly, maybe. We haven't seen anything in stone yet. We have signed the contract extension because we had to, otherwise we would have had to start over.
Yeah.
Which, anyways. So I don't want to like get into too much of that, but just try to make sure I give an update. Yeah.
So, this is like a publicly funded program, and would like social media pressure help, or like an op-ed or any type of, cause I know like, especially as elected officials, they can cave to that.
Yeah, so we did a social media campaign and a sign-on, and we worked to get we had the Black Joy op-ed in Sahan that came out, and we worked to do the letter sign-on as an op-ed, but nobody picked it up. So we tried that. The thing that we've actually pivoted towards is that when folks are talking about like economic models, so we are a multi-stakeholder co-op, and that means that we have different member classes. One which we've never opened up is our resourcing member class, which allows, like, this is a cooperatively owned initiative because we are a co-op. So not only is it currently publicly funded, but it actually is co-owned by our members, which is pretty dope. And so like folks can resource the project if they want, and then be a member and have voting rights in the org. So we, in response to like the desperation that we're in, to put it frankly, we opened up a class of membership that's always kind of been there, hopefully we never have this moment, but we've opened it to be like, okay, like, you wanna own part of this project, like, pay $10 a month and you can own part of this. So that's where we're at, but we take any and all support to make it happen, because this is the only project in the country happening like this that is community-led, community-owned, that uses the methods that we use around reparations. Like, if this ends, that's gonna be a big deal. I don't know how else to like say that. But you should come to the assembly next week on Wednesday. You should tell your folks, because the more folks that are here, the more folks that are gonna experience the project, get to be a part of this definitional piece and all that kind of stuff.
What
So,
time?
It is next week from 5:30 to 7.
On Wednesday?
It's on, yeah,
It was on there.
it was on there somewhere. I will drop in the chat, yeah, next Wednesday, and it's here. Next Wednesday here, and there's a registration, even though I'm telling you that it's here, that's not like public, folks get that information when they register, but just so you know, it is here. I'm encouraged to register because we've eaten, I wanna know how much food you get. Yeah,
Do you have any connections to some of the stuff like that Trey Earn Cruz is doing?